Welcome, 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 family. This is your man, Jakim Muhammad, with the Hard Talk with Jakim. Listen, I got a special Hard Talk with Jakim today. This one is about insurance. Yeah, we've got a race coming up, a primary, and we've got a general election coming up. But listen, Delaware, insurance is very important to me. It's very important to my wife. You know, she does health insurance, and should be very important to you. So today we have some great guests from Delsure Insurance. I'm not going to mess up their names because I know them. I met them a while ago. Kristin Freeberry. I am so glad to have her here. And Dr. Abbas Bayat from Delsure. And let's give them a round of applause because they are on with the Hard Talk with Jakim, and we're going to get down with the nitty gritty. First, introduce yourselves, family. Yeah, Kristin.
Hi, I'm Kristin Freeberry, and I'm the Administrative and Regulatory Relations Manager here at Delsure. I've been here 2 years now, and I'm all fired up about health insurance and the costs in Delaware.
My name's Abbas Bayat.
All right, and next up.
Yeah, Abbas Bayat, and I founded this company with 17 doctors who are completely fed up with the way the system works now. And we put our heads together and came up with a solution that serves both the doctors and people and simplifies stuff so it costs a whole lot less. And we're hoping to bring that to Delaware and then take it nationwide.
All right. Well, you listen, I went to your offices and we had a great discussion over there, and looks like you're trying to offer the residents of Delaware affordable insurance. What do you say about that, Kristin?
Yes, so the current model of health insurance is broken. So we are trying to do things completely different. We offer no co-insurance, no deductibles. Our doctors get paid at time of service using a virtual credit card off our app. And we have no prior authorization on anything, including prescription drugs. So if a medical doctor, a medical professional says you need something, that's what you get. We also won't keep medical records. With the 10 essential health benefits, you can't discriminate against anyone for prior or pre-existing conditions. So we have no reason to keep your medical records. Your medical records and your medical decisions are made between you and the doctor of your choice. We also have an open network. So you see the doctor of your choice. We just want to take the health insurance out of healthcare. We don't think your healthcare decisions should be made by a health insurance company. We try to stay in our lane and simply finance our members' healthcare.
Can I
That sounds fantastic.
can I just add quickly a preface to that? We are in the process of getting our authorization. So right as of now, we can't write insurance, and we're not offering to sell insurance this minute. And of course, one of our problems has been that the Department of Insurance has not been at all cooperative. In fact, has put obstacles in our way from day one and has been quite arbitrary. And we're now involved in a legal battle with them. We've already spent $1 million in actually establishing ourselves, and probably 40% of that, 50% has been on legal costs, fighting the department. Both taking too long to originally give us our certificate, then taking too long for our rate approval, and ultimately using some arbitrary and stupid reasons, trying to revoke our license. So now we're in the courts fighting them. But it's very important to say that we will only be able to sell insurance once we're properly licensed and our rates are approved. But I'm pretty sure we're going to get that because the statute supports our position. The statute is very clear in what an insurance company needs to do to be licensed, and we have all those requirements. So it's a matter of time before we get it. just to add a little bit to what Kristin said, the problem in health insurance is not necessarily the premiums. What the insurance companies make you pay yourself, whether it's the deductibles, whether it's co-pays or co-insurance, actually makes it unaffordable. Because in Delaware, the average policy that's offered on the individual exchange, and there's only one company that does it, Highmark, will require you to spend anywhere from $7,000 to $8,000 before they actually pay a single penny. That's on top of the premiums. So to get health insurance, that's a silver model, for example, where you get 70% or you get 30% so-called cost sharing, you actually have to spend about $11,000, $12,000 before they even spend a single penny. It's just unconscionable. It's just crazy. That's why they make so much money, the health insurers. That's why they literally are making billions of dollars. It's not millions, it's billions. They pay their CEOs tens of millions. And they pay their doctors.
Doctor, that's one of the reasons why we wanted to get this out to all of the citizens and constituents in Delaware, that if you have choices, the more choices you have, the better off that your premiums and co-pays and everything else that's involved in insurance would come down, as long as you have as many choices. If you don't have a lot of choices, you don't have a lot of options. Am I right, Kristin?
You are right. And back to the current model being broken, there is no reason why it needs to be done with co-pays and co-insurance and narrow networks. Those are all tactics that the health insurance companies employ to drive up costs and cut utilization. It's a strategic effort. In the last 4 years alone, health insurance costs have gone from the 8th highest in the country to the 3rd highest in Delaware. Delaware is now the 3rd highest, and no new choice has been brought.
Hold on, Kristin. Hold on, Kristin. You got to say that one more time so that our viewers can hear that one more time.
Yes, in the last 4 years, the cost of health insurance in Delaware has gone from the 8th highest in the country to the 3rd highest.
Wow.
In addition,
how do you say about that, Dr. Abbas?
In addition, the rates in Delaware are 30% higher than they are in Pennsylvania, New Jersey, and Maryland. If you live half a mile in Maryland, as opposed to half a mile, and you work in Delaware, okay, you work in Maryland, you pay 30% less.
Wow.
That's down.
Wow. These are stunning facts.
Okay. And it's
these are stunning facts to me, and these are out there, right, Doc?
Yeah, these are absolute facts. I mean, in fact, insurance companies have to put all that information on the website of the departments of insurance. You can go there and look. You can go there and look and see Highmark in Delaware charges more than Highmark in Pennsylvania.
Wow. That's, and for a small state that we are, you would think that we would have as many choices as possible, and that our cost would be just a little bit lower, because we don't have a lot of the overheads that the New Jerseys and New York, Delaware's, Pennsylvania's have. So how do you feel about that, Kristin?
It's alarming. It's shocking as I'm going through this and learning more that this is not more of a priority for our legislators. Like I said, we don't need to do things this way. It doesn't need to be all these hidden out-of-pocket costs and lack of transparency. I think it's very important for the citizens to demand absolute transparency. We need to know what's being billed, what is the health insurance company paying out. It's difficult to get that information, and that's on purpose as well.
Wow. I dealt with a lot of insurance, anybody who's an adult, that's called adulting. You have to deal with insurance, life insurance, health insurance, even dental and other stuff. I have found that most of the times people don't want to deal with insurance just because of a lot of the lawyer talk that's involved with it. Do you agree with that, Dr. Bayat?
Yeah, absolutely.
Abbas.
Absolutely. If you look at a policy that you get from your health insurer, it's about 50 pages long. And everything is caveat, caveat, and then footnotes and stuff you don't know. I mean, it's stupid. You don't need that. The only reason they have it is so you don't know what the hell's going on. When you receive a bill from your provider, you say, okay, then you get another notice from the insurer saying, by the way, this was how much was billed, this is how much was allowed, and this is how much was incurred, but you're gonna have to pay it because you didn't meet the deductible. So you have no idea what it is you're liable for, what it is you have to pay. And on top of that, the provider doesn't know what they're gonna get. They're sending a blind invoice. The insurance company sends them something back after 2 weeks or a month. So by the way, this patient you treated hasn't met his deductibles, so you go collect from them. And the doctor then now has to have a fight with their patient to say, well, you owe me this. And the patient says, well, why? Why do I owe you this? And the doctor doesn't have time to explain, well, that's because your deductible was such. People don't look at that. People don't read the fine print because they don't have time to do it. And brokers don't explain stuff to them properly because they're paid by the health insurer. And you know, he gets his commission, so he's not going to explain to them, by the way, you're going to have to spend $8,000 before you actually get a penny from insurance. Nobody would buy it if they knew that.
You're absolutely right. I know I wouldn't buy it, and I'm frugal with my money, and my wife is even more frugal with the money, and I love her for it. That's why I married her. Yes, you're absolutely right. I think a lot of times they get away with a lot of this is because the public doesn't know or doesn't want to know. I really can't tell you because in the age of information, that information is out there. You know, the information about what your insurance commissioner is doing. Why are things doing that particular thing? This is not a knock on the current insurance commissioner. What I am saying is that things have to change in that office so that it benefits all of Delaware. What do you think, Kristin?
I totally agree. In addition, well, let me back up and say that Highmark does over $3 billion a year in Delaware alone. And again, we've already cited that they don't have much competition here. But recently, Delaware passed what's called the reinsurance. And there's only about a handful of states that offer that, which means that anytime there is an expensive case, that being $65,000 or over, the state will then pick that up, and Highmark will be off the hook for that. And why? It's not the proper tool to try to reduce costs, certainly from the government. But I don't think I'm not sure that was properly understood or researched. In the cost of the premiums, Highmark already factors in the fact that something, a big case could happen like that. You'll have a very expensive case. It's already factored into their premiums. And if they do so much, revenue here, why is it that they should be off the hook for those expensive cases? I'm not understanding it.
Well, let me just say this. Are we just giving away money? Is Delaware just giving away money to these big companies?
In this case, yes. For their rate, they just put in for a rate reduction of 0.5%. The commissioner agreed to 1% reduction. Okay. Now, in 2020, the cost for insurance companies was halved because people didn't go to the doctor. So from March to July, hardly anybody did anything. They didn't get any elective surgery. People didn't go to their doctors, etc. So the costs were minimal. on top of that, for 2019, they approved a reduction, which in effect was not a reduction because they got this reinsurance stuff that kicked in. So now what they're saying is, because they can't hide it anymore, they're going to rebate among all the different people, the small groups and the large, and the exchange individual. They're going to rebate about $20 million on 2019. So in 2019, they should have reduced the rates more than the 20 million, because the 20 million is just their figure, which is not accurate. And now in 2020, they're only reducing the figure by 0.5%, by 1%. So it's just completely fabricated. It's rigged, and it's rigged against people. It's not rigged against, because they all sit on each other's boards. Highmark, Christiana Care, they all huddle in the same places. All the big wigs in the parties and legislators, they're all in it together. What's important is not to follow party lines in cases like a commissioner. A commissioner needs to know what they're doing. It's party agnostic. It doesn't matter whether you're the most severe conservative or the most severe progressive. Insurance is technical. Insurance is not political. So you need people who understand it a little bit. A sheriff cannot know what insurance is, cannot understand the underpinnings of insurance, what actuarial science is, what is the statistics, what is risk sharing. You don't know that. You need to be knowledgeable of those. So it's very important to elect people who understand even some aspects of it. I'm not saying you should elect people but somebody who at least knows some accounting, who understands some statistics, who knows what math is about, who knows what insurance means, so that you don't get this kind of crazy increase in rates. I mean, there's 200 million, 300 million a year that the citizens of Delaware are being screwed out of. It's not right. It's not fair.
Well, you know, most of us didn't understand the realization of why math was so important until you became an adult. And yeah, we may not do the trigonometry and we may not do the calculus, but basic arithmetic and basic counting and subtraction and multiplying is important. And I will say this, if you are not good in that, these people, the insurance companies, will run roughshod right over you, because they've got more tricks, more bag of tricks than Felix the cat ever had. But I will agree with that. What do you say about that, Kristin?
I agree, and that goes back to what we were saying about the cost sharing, the co-insurance, the co-pays, narrow networks. It's all a concerted effort to drive up revenue and profits while cutting utilization, and it's really to the disservice of citizens.
Right, and believe you me, this is not a D and R or thing, or this is just basic math that we can afford to have this type of stuff going on in Delaware when people are struggling. COVID-19 has exposed a lot of things. Mm-hmm. And one of the things that has exposed is that insurance rates and insurance on a whole, needs to be reformed. Since everybody's into this reform thing, needs to be reformed. Mm-hmm. Because the way it's going now is unsustainable. What do you say about that, Doc?
Absolutely. I mean, I make an equivalency between climate and healthcare. Both of them are critical to people's survival. If you can't breathe proper air, you end up with diseases and going. If you can't get healthcare, if you can't go to your doctor, you'll end up getting diseases. Okay, both of them are as unsustainable as each other and as important to humanity as each other. So it's critical that people pay attention to healthcare and separate it from how it's paid for. The government supports mortgages, okay? They guarantee it. They give you all kinds of benefits. The interest is tax deductible. And the cost of a mortgage is peanuts. It may be 0.5%, okay? So the major cost of a mortgage is interest payment, which is borrowing the money. And that goes up and down depending on what the rates are. So that's the way healthcare should be financed, in the most economic, efficient way possible, to pay an invoice, to pay a claim, and then to let people get on with their lives, to let doctors treat patients the way they've been trained to treat patients, and to take away the stress that's constantly there. It's equivalent to the evictions we're getting now, okay? It's the same. People don't get their health care, people get evicted. So, I mean, you're as nervous about eviction as you are about healthcare. You're as nervous about, not being able to get your care as you are about being out on the street because you couldn't pay your rent. And
well, I was.
Yeah, sorry. And the ACA, for all its faults, will subsidize premiums. So if you don't have any of this cost-sharing nonsense, some people may actually not end up paying anything for health care, for health insurance, because the government will subsidize those premiums. So the exchange can be a very useful tool in actually making healthcare. Now, in Delaware, generally, small businesses can also get all of these subsidies, as individuals can. But you need to have an insurance company that offers small group employment insurance on the exchange. In Delaware, there isn't anyone. Highmark.
Hold on, Doc. For a second, you say there's no group, there's no insurance company offering small group
on the exchange. Highmark offers it off exchange because they can make more money off it, okay? And they do get people on it. But the commissioner didn't say, if you want to be in this business and that business, you better be on the exchange. Because on the exchange, these small groups, fast food, retail, all of these people the salaries of their employees are less than 2 times or 3 times the poverty, or less than 50,000, they will get subsidized. The government will pay their employer the subsidies. So people in Delaware, small groups, cannot take advantage of that because there's nobody on the exchange to offer it.
Wow. Well, Kristin, we've got just a couple of more minutes left. I want you to make your case to the citizens, especially the citizens in communities that have had disparities and inequities, why something like this from Delsure and something like this from any insurance company would be great for Delaware to have if the commissioner allowed it.
I'm going to let Abbas answer that, but I do just want to give the example of like car insurance. Your car insurance doesn't tell you when and where you can drive your car, what time of day, what roads. It does not tell you where you can go get your car fixed or go get it worked on. Health insurance should be the same. But Abbas will be able to speak better to our case.
Thank you. Doc?
Yeah. Look, the most important thing about healthcare financing is to pay a premium which you may never use to get coverage for some catastrophe, which doesn't often happen, okay? Most people, 95% of people don't end up in a hospital bed. Never. Okay, it's only 5% that end up. So if you make the premium affordable and reflective of what it really costs, and you get rid of all this cost sharing, so somebody literally pays once a month and that's it, and then goes to wherever they want to, then you have a proper financing of healthcare that people can afford. And gradually, not gradually, immediately, with what is on the law, on the books with the ACA, you can get, up to 80, 90% of the premium subsidized, paid for by the government, whether it's an individual on the exchange or small groups on the exchange. A small group is a group less than 100 people. So you can almost get insurance for free. It's not for free because the government subsidizes you, which means every person can get it. Every person, if they only have to pay $100 of premium or $50 or whatever it might be after subsidies, everybody can afford it. Everybody. So that you would get the whole population insured properly. I mean, it's a better version of Medicare for all. It's a cheaper
I will say
version of
this.
Medicare for all.
I will say this. Both of you have got a great case. If people wanted to find out more about Delsure Insurance and what they can do to help you get into the insurance market here in Delaware, how can they do that?
Kristin, go ahead.
Yes, so you can obviously always go to our website, www.delsureinsurance.com. In addition, we have a WeFunder campaign that's up and running. You'll find the information off our website, but it's wefunder.com/Delsure Health Insurance. And they may always call the office at 302-286-5333.
And vote for the right candidate.
And vote for the right candidate. Well, listen, Hard Talk had already endorsed Coyote Abagunde, and I had to put my African tongue in. I already endorsed them. But yes, vote. Make sure you get out there. Get this information, people, man. It's been really a pleasure having Kristin Freeberry here, having Dr. Abbas Bayat here from Delsure. This has been the Hard Talk with Jakim Muhammad. Peace out, family.